do it. It tells you I was so much into it to ensure that the right things are done. So it's good. It's a learning process. If everybody goes through it by reading through, you know that you would have even learned a lot to help you yourself.
Yeah, thank you so much for sharing that. And so how, on average, how long did it take you for each, how long did each review take you on average?
Personally, it took me about 2.5 hours.
Wow. Okay, and I see there's a question in the chat from Laurencia Caesar, on saying one of the reviews that you received had nothing written down, just an empty template. What's the way forward? So we saw a particular situation like that. I don't know if it was yesterday or day before yesterday. I'm actually going to share your screen, your Peergrade page, Laurencia. Let me just, okay. Because I see you have actually completed all 3 peer reviews. Or this is the third one. Is the third one that's actually empty. I don't know, Laurencia, are you able to unmute yourself?
Hello.
Yeah. So it is your third peer review that is empty, actually. Is that right?
Yes, please.
Okay, but one thing I can tell you is you can still note it. So for each part, they say the question, remember, no summary, nothing was written. And then you can actually guide the person, say, maybe you made a mistake and submitted the wrong template. So sorry, but this is what was required of you to do in this section. See, you see, these are the main key points. Okay. Yeah, so that you meet the word limits.
All right.
Is that okay? Yeah, okay. Excellent. Because maybe some people in the last minute trying to submit in the rush actually went into their computer and uploaded the wrong document.
I think one of the peers,
I think so.
That he did the same thing, that if he submitted it, later on he realized that he picked the wrong thing from the laptop. So I think that could be, yeah.
Yeah, so unfortunately for him, once the deadline is passed, you can't change your submission. Meanwhile, if he had done it before the deadline, there's a possibility to go back and change. So once the deadline is passed, once peer review has started, there's no way to change the submission, but he has the opportunity next week to actually submit the right document, because next week is going to be revision. So I think, okay, we are really going to start now because it's 4:30 in Geneva. So warm welcome to you. If you're just joining us, it's our 9th technical support session for this first full learning cycle for the movement for Immunization Agenda 2030. And we are actually in the 3rd week of our exercise on situation analysis. And this week there is one focus, one goal: to complete 3 peer reviews for your colleague situation analysis in Peergrade. And why does peer review matter? I was just listening to from Daniel from Ghana that was sharing with us that it took him 7 hours working in the night to go through the 3 peer reviews, an average of about 2.5 hours for each situation analysis. He sat down, read through line by line the situation analysis of peers and gave constructive feedback. Why? Because he thinks that his peers depend on his comments to improve upon their work. If he took all this time to do these peer reviews, and at the end of the day, you don't do the same for your colleagues, that will not be fair. They won't be able to move forward and to go ahead with the exercise because they depend on you, they depend on your feedback to improve upon their situation analysis. So, and remember, the golden rule for peer review is leave comments in a way that you would like to receive them yourself. Always ask yourself, this comment that I'm writing down, if my peer was to give me the same comment, will I appreciate it? Secondly, are the comments clearly written, specific enough for my peer to use to improve upon their work? Thirdly, do I have experiences around what my peer has shared that could help them to understand better the situation and improve upon the quality? So these are the kind of questions you get to ask yourself while you conduct peer review. That said, I'm going to be asking you this question, and you should answer with a yes or a no. Answer with a yes or a no, like I've just done in the chat. Have you started peer review of your colleagues' situation analysis in Peergrade? I'm asking if you have started. If you have started, and Laurencia says yes. If you have not yet started, type no, please. Okay, Joy, yes. Raul, Don, that means yes. Excellent. If you have not yet started, please type no in the chat, because we are here for you. We are here to ensure that we use this time we have together to start and to see how to go through the peer review. So far, only 4 people have responded. Please go ahead and type a yes or a no in the chat in response to the question that I'm asking. Have you started? Or if you are finished, type yes, I've finished. Type yes, I've finished. Please, okay, Ozinku says, it's done with the 3 reviews. Ozinku, the WHO level 1 certification course with the Movement for Immunization Agenda 2030. Okay, excellent. And I'm getting indications that my connectivity is not very stable, but I hope you're able to hear me. All right, so far it seems as if everyone in the room has already at least has already finished the peer review. When I checked this morning, I noticed that 355 people had submitted their situation analysis on Peergrade, and 93 had completed the 3 peer reviews. So it means that many of those who have not yet started peer review, they are not in the room with us. But if you are here and you have not yet started peer review, please, can you just go ahead and unmute yourself? Can you go ahead and unmute yourself, or you can type in the chat to tell us if you're facing any, we can give you the support that you need. Okay, I see Julius Abatani says that he just finished with 1. That's excellent, Julius. Julius, please, are you able to unmute yourself? Julius, are you able to unmute yourself? Okay, maybe Julius is not able to unmute. So I'll just go ahead and go through step by step for the sake of those who will be watching the tutorial of this the tutorial for this of this particular session later on. So I'm just going to go through, and Uzinku, please don't be confused. This technical support session is for the situation analysis peer review. As what concerning assignment 3, go to learning.foundation to your learning personal learning space and watch the tutorials and the resources that are there. Thank you for your understanding. Now, how do you submit a peer review on Peergrade? The first thing is you need to log into Peergrade. You need to log into Peergrade. I'm going to share the link in the chat, and I'm inviting Julius Abatani challenge with peer review, but I want you to take advantage of this time we have together to continue with your peer review. So if you can click on that link so that you can continue to work on the others, so that this time that you have, I know you're very busy as a professional, so at this time that we have together, it will matter for you. You will take advantage of it, at least to make progress as far as peer review is concerned. So once you log in to a Peergrade, you need to, this is the page that appears. asking you to give that. You have to give the feedback before Friday, 8 April, 11:59 p.m. Geneva time. So you click on the link, give feedback. Once you click on give feedback, you'll be invited. The first submission is going to appear. Sorry, this slide is a little bit flu, but it's just showing you that this is the work of the first peer, and it is what we call submission 1. So there are 3 submissions that you get, and if you click on this little arrow here, you're going to see that submission 2 and submission 3 will be locked. Submission 2 will only be open after you have completed and given feedback for submission 1. So what you need to do is to read the peer's work very carefully from start to finish. You can even download it. If you're having connectivity issues when you're doing peer review, you can actually click on this download icon to download the work of the peer. Once you have downloaded it, you take the time to read through carefully. And once you read through, you can come and grade the peer's work here in Peergrade. So you choose a rating, and where it's written additional comments, you explain your rating and give concrete and specific suggestions that will help your peer to improve upon their work. So you have to do that for all the different parts, of the situation analysis. And once you have completed giving the feedback, you can then go ahead to click on submit. One way for you to know that you have given useful and constructive feedback is if you see here, you say you have written 323 words more than the average student. Good job. So here actually 300, you have the number of words that you have written for your peer review. So once you get that, you click on submit feedback. Once you click on submit feedback, submission 2 is going to automatically open for you. And then you'll be able to continue with the same process until you click on submit feedback. And once you click on submit feedback, submission 3 will automatically open. And there is a tutorial. It is quite long, but it will help you to guide you step by step on how to carry out and submit a peer review. I'm sharing the link with you in the chat. So right now, that is it in a few steps. It's very straightforward. Carrying out a peer review is very straightforward. So now I think we can use the remaining time that we have. If there is no one with a question or a challenge in the room, we can use the remaining time that we have for experience sharing. So you can actually share with us. If you have already completed your peer review, go ahead and raise your hand if you want to share one peer review that you have done with us. Don't worry if you're not able to share your screen. I can do so for you. So I'm going to ask Joy Ataoti. Joy, you said you've already finished the 3 peer reviews. Are you able to unmute yourself? Oh, okay.
Yes, I have. I've been able to unmute myself. Good afternoon, everyone.
Good afternoon, Joy. So should I share, do you want me to share the screen?
Actually, I'm using my Android phone. I don't know, and I don't have my situation analysis on the phone with me right now.
So I was saying that I'm going to share the screen for you, so that because it's actually about you sharing a peer review that is of a peer's work that you have reviewed, of a situation analysis that you have reviewed, and you summarizing what the peer gave, and then sharing the comment.
Stable.
Okay, that's okay. So
I can hear you now.
You can hear me now?
Yes, yes.
Because I've actually already opened your Peergrade account, and I'm already on one of your review page for the situation analysis. Should I share my screen for you to see if you can tell us which of the situation analysis that you want to comment on to share today? So there is this is submission 3, vaccine hesitancy among remote community dwellers. Do you want to share on this one, or should I look for another one?
No.
Unfortunately, Joy, I'm not able to hear you. It's like you're having connectivity issues.
I'm having issues with connectivity, but I can see I can see you have already shared my screen.
Yes.
Okay. So maybe as long as the this is the last one I did yesterday, I guess.
Yeah. So do you want to share on this one, or should I open a different one?
It's okay. I can share on this one.
Okay. So please go ahead.
All right. Thank you so much. The first question was whether what is the current level of work for the author's cover note, and my response to that. Sorry, because I'm using my Android phone, it's not really. Okay. So the first thing I noticed here was that the person actually had a
unfortunately,
summary.
your connectivity is really on another day.
Uh-oh.
Yeah, I think we can get to listen to you on another.
Okay. So should I go on then?
It's okay. So we.
Should I go on then?
Yes, please go ahead.
Okay. The person identified his they identified their challenge, which was vaccine hesitancy among remote community dwellers. Okay. So one thing I noticed also was that he did not select the key area of focus. He only wrote the key area of focus as KF3, which I told him about. My first summary was that my first response to him was that his summary was excellent, and so I told him that his summary was very good, and that the author tried to capture his challenge while stating the reasons for the hesitancy. Which was his challenge? Hesitancy was his challenge. He also gave a good background to describe the people and why it's important to deal with this particular challenge. So then I went on to look at his cover note, because in his cover note, he tried to describe the kind of people. I mean, sorry, in his in the part 2, that's my situation. He tried to describe the kind of people that were in that settlement. He said that the rural dwellers were very friendly, but that they were not accepting, that they were not accepting, that there was a lot of hesitancy in accepting the vaccine. So he was wondering why, even though the people were friendly like that, they did not accept the vaccine. So he thought the question he needed to ask was, what is the information that these people have about immunization? What is the source of their information, and why there was such a high level of hesitancy? That I thought was good. I thought the challenge, the questions he tried to ask were appropriate. But later on, I discovered that he asked some. The questions he asked, that there were too many, and that the only 2 out of the 4 questions he asked would have been enough, would have been adequate to help him answer his, to get his solution to the problem that he was, that he identified. So, and I told him so. Next was, sorry, can we move down, please? To another thing I have is data sources. Hello, can you hear me? Hello, can you hear me?
Yes, we can hear you.
All right, thank you. Please, can we see the data sources?
Yes, I'm on the data sources.
Okay, that was where another place I thought okay, so he said his data sources were from the WHO guide for conducting situation analysis, as well as then the IA2030 Full Learning Cycle strategic priority. And I thought that The author, I thought that he needed to use other local data sources. So my response was that the author identified 2 data sources, which was the list that we were asked to do, but that they don't seem to be the best ones to answer the question. I think these ones that he used are better suited as guides to help us. You know, they are like guides for a more generalized analysis. But for this particular challenge that he has identified, I thought that he would have look for other local data sources like tally sheets, vaccination register, and then the ideas engine, etc. And I pointed out to him that if he could do that, it might help. And finally, in his references, can we move down, please, to these references? Okay. So the references.
Can we look at the key findings? What about the key findings?
Aha, key findings. Okay. Yeah. Yes, I thought that the key findings, his key findings were that the most likely answer to my question is that the vaccine hesitancy is due to ignorance and influence of some of the uninformed or wrongly informed influential people among them. So I thought that findings somewhat answer the questions. As my response to that, his findings somewhat answer the question, but they do not seem convincing enough. So I said the findings were recorded and that they answer the question, but that there was no explanation to convince the reader. And I suggested that it would be good to provide a clear explanation to these answers that I have, which are very good answers, but that a clear explanation would help the reader to understand better. So that was that about the key findings. And so the next steps. Yeah. Also, yes, the next steps. I discovered that his next steps were really excellent. And so I said, great next step. And that they will really, and that it will really help to, and that they will really help to solve the problem that has been posed by the challenge. So because he had these great next steps that he would suggest town hall meetings with the community primary school to educate the student, and also that he would, because I think he was trying to talk to the opinion leaders and people that matter in the community to help inform other people who are not, who will also inform others, and before long, everybody will be in sync for them to understand the necessity for immunization, and that will reduce hesitancy. So I thought these were really great next steps, and I commended the writer for that, and that was that about the next steps. So finally, it was his references. The references, okay, he identified 2 ideas that he had used from the ideas engine. Yes, they were related to his challenge. And so I said these were excellent sources. 2 ideas were cited from the ideas engine, and they were adequately acknowledged, along with their identification numbers and the authors of those ideas. But I also said that it would have been great for the author to have cited other sources. If he had to have used other sources, like the local sources that I talked about earlier, and since it was even allowed, it is allowed for us to use sources, to use data from other sources different from the ideas engine, and then to cite it in text, that we were allowed to do that. If we use other sources, that we could cite them in text. So I suggested to him that he could use them and then cite them in text. Thank you very much.
Thank you so much, Joy, for sharing this
a peer review of a situation analysis with us. And I would like to invite those who are in the room, we have been listening, you have already either started peer review or already finished. What comments can you share with Joy concerning her peer review and concerning this particular situation analysis on vaccine hesitancy? That's the challenge. So please go ahead, feel free to unmute yourself or raise your hand if you want to speak. Feel free to unmute yourself or raise your hand if you want to speak. Now, while you are thinking about it, or you can also type your comments in the chat. So while you are thinking about it, I have maybe some observations to make concerning the work that was submitted by this peer. So my first observation is like Joy. I really want to appreciate your review of this work. His challenge was getting people to appreciate and accept immunization. So it means that the main challenge is probably vaccine hesitancy. So, well, first of all, look at his cover notes. Let me just mute. So, first of all, look at the cover note. Remember what is asked, that the cover note is like the key points. That is like a letter that it's like your summary that you're writing to your supervisor, and you want to like maybe provide bullet point summary that helps your supervisor to understand the situation clearly. I remember we said yesterday that you finish the cover note is actually the last part of the work. So you finish this section, you finish all the other parts before coming to this. So normally, if I were to do peer review, I could actually start with the situation before coming to the cover note at the end. So concerning the situation, let's have a look. Our peer is from a country of focus. So the peer did not really indicate the country, but it's Ogboro Goro Akpo district. Okay, from Nigeria, that's Nigeria, thank you. And it's a voluntary community health staff. So we know that it's from Nigeria. So here, maybe in terms of what was really important, and like Joy, you highlighted, in the situation is being able to have some more detail in terms of maybe even the coverage. It could be the immunization coverage for a particular campaign if the learner participated in it, in terms of maybe the weight of the refusals, in terms of vaccine hesitancy. Is it generalized? Is there a particular group of people? What characterizes those people? So what are the characteristics of the people that are living there? Is it about, what are the reasons? Have you been able to find out? And maybe we can take a look at the questions. What are the previous information these people have on immunization, and what were the sources of this information? What is their knowledge of infectious disease and immunization? Why is there so much level of vaccine hesitancy among these people? And why do they lack trust in the government and safety? So in fact, maybe some of the question is already like trying to answer the why of the vaccine hesitancy. Because, so remember we're saying you have to ask the rule of the 5 whys, the why of the why of the why. So why, and if they say because they don't trust the state and all of that. So those are, I just think that in the feedback it's important to state, you know, it is good, it is very necessary for the person. You can suggest to him, like I like the fact that you suggested I can get data from vaccine register, tally sheets, community health records. I don't know. He could even do, if he's a community health volunteer, he could actually, if he does home visits or is in touch with some association, he could do some key informant interviews. And talking about that, I would like to turn towards Farm Daniel, because Farm Daniel, this reminds me of you, of what you have been doing in Ghana, you know, concretely. What kind of feedback can you give to this peer that can help him? Because I think his challenge is in line with your challenge, and he can learn a lot from what you have already been able to do.
I think if I might come in, I thank the reviewer very well. There are some issues very valid. I think I also had one of the peers only stating what has been done in certain areas, and he was going to use it for his area. But I think it wouldn't have been a problem that he's going to use a data from other sources to work on his work. But the most important thing is that when you are using a data like that, you need to be able to know that the data you are using, you need to be able to really support why you are using that particular data. What are the limitations and the assumptions of that data source you are going to use? Because maybe you don't have, there's a missing data. And so once you know there's a missing data, you can't find it in your local area, and you are going to use other areas to do, then it means you must be able to state that data which is supported by evidence, and to indicate the assumptions, the biases, the limitation, and be able to explain all the trends, the patterns and the contradictions, especially, so that if that data, because it's missing, you have that evidence that can really support it for you to use it. But if you go and just pick data from somewhere and you don't do anything at all from your area that can support you, then you might have an experience from somewhere which cannot be reproducible in your community. So that is why in my area, what I did was, when I got to know people are showing hesitancy, I just took it upon myself to do key informant interview in 2 ways, just to talk to community members or the public who come to the hospital, and also to talk to healthcare workers, to know all of them, the actual reasons behind why they are showing hesitancy and refusing to take the vaccine. And really, it was joy. It was something that I started doing it myself. I asked them, and some of them didn't even know that was what I was actually doing, because the way I structured it, it wasn't let me say, a written interview or those things. I asked them one-on-one, is some informal way. And that one, they were able to give out all the reason, because they didn't know it was steady. Because one thing I realized is that sometimes when they see it that it's a steady, they don't want to give all the actual reasons. So informally, I was able to ask both healthcare workers and the community, because that is where I'll be able to know exactly their reasons. And you have to use the 5 whys to keep on asking them questions. And they felt freely and they talk. And that is where I had a lot of key findings from them. So I think that is what he's supposed to do concerning this one. And also, as he said, we could use all that tally sheet, the register and everything. And since the 6th point, the references, it deals with only the ideas and their author and the references. They said that you should acknowledge other references in your write-up. So in your write-up, doing the data source, you can mention all this as data source and give it a reference there, so that everybody will know that this is the reference. So there's no need to bring it to the ideas, the references on the ideas engine, because that one is specifically given for us to see whether we're able to explore the ideas engine to find ideas, practices, experiences that others are doing. Because in my case, I had 7 ideas. I decided to really go explore the ideas engine to get information from other peers. And I realized that most of them are doing the same thing that I was doing in similar way or the same way. So I was able to get ideas on how things are working in their areas to support me in my local area. So I think that the ideas engine, we need to explore. That is why it was put there, so that you can be able, you don't reinvent the wheel. Some of the things you can easily find them over there. Thank you, Charlotte.
Thank you very much, Farm Daniel. I see Saeed Miraban Shah. Saeed, your hand is raised. Go ahead, and warm welcome to you if you're just joining us. If you're having any technical concern, you can type in your concern in the chat and we'll get back to you. We went into experience sharing because no one had any technical issues in the room. So we said, okay, we can take the remaining time that we have for experience sharing. And we understand if you have to go now because the time for the session is already ended. But if you want to stay, you can go ahead and stay. So over to you, Saeed.
Thank you, Charlotte. Thank you, colleague, for the representation and giving feedback on this. This is Said Mehraban Shah from Afghanistan, WHO Technical Officer EPI program at national level. My question is that I'm still waiting to receive the feedback from the colleagues that my situation analysis was shared with how many people and when I will get feedback, because I have received 3 situation analysis to provide feedback, and I have already done that, and I'm just waiting for my own one when I will get feedback, because the time is short, and when they will submit the feedback, so that I can reply to their feedback and comments on time before deadline. So the question is here that my brothers explained regarding the next steps that which was there, but based on the situation analysis, the key findings, the next step should be based on the key findings. But to see this there is the limited number of key findings, but the number of next steps are too much. How it is matching with this? Thank you, and over.
Okay, thank you very much, Saeed. And I'll be answering your question in a short while, because you're asking a very good and legitimate question concerning when you're going to receive feedback for your peer review. And thank you for raising the issue of the key findings and the next steps, because to me, if I were to give like, we don't know how the colleague drew the conclusion that vaccine hesitancy is due to ignorance and influence of some uninformed or wrongly informed influential people among them. When I went through his situation, I did not see anything any information that shows that the people, were getting information from elsewhere. That is the first thing. And now maybe that is why maybe the key findings, and I like the fact that Daniel mentioned it, is trying to say maybe missing information, what I have not been able to do, or he would have said, I spoke to maybe 5 people, 6 people, or I've spoken to these people. I found out during a home visit that this is why the people are hesitant. And so now the next steps I would have suggested, he says the first action I would suggest is a town hall meeting with chiefs, with men, women, and youth leaders, during which they will be enlightened on disease, infection, and the role of vaccines in the prevention of diseases. They will be given time to carry the message to their people. So for me, this first next step will actually could have even been a fact-finding mission. That is to look for the real why the people are hesitant. So it should be an opportunity to ask them to listen, because it's not just about us talking to the community. We need to engage them. And when we are engaging, they have to have the opportunity to speak their minds. Okay, I see Stephen Banner, your mic is unmuted. Do you have something to share? Stephen Banner?
Okay, we are not able to hear you, so I'm going to mute you. All right, so basically, so like Syed said, I think from just that one action with meeting the people, he will be able to fashion more concrete next steps that will produce the desired results. Because even visiting the community primary and secondary schools for health talks, if parents are not do not give their consent on vaccination, you will not be able to vaccinate the children in the primary school, even the teachers and all whatnot. So, okay, I see Ibrahim Abdullahi Maikano, your hand is raised. Please go ahead and unmute yourself.
Hello, good evening, Charlotte and colleagues.
Good evening, Ibrahim.
About State Nigeria. Yesterday, last week, it's a week of confusion to me, but in fact, the day I've done the briefing on I and make to understand that.
Sorry, Ibrahim, your voice is breaking. We are not able to hear you.
On community and local government as well.
Ibrahim, we are not able to hear you. I don't know if...
Hello, Charlotte.
Yes, please, can you come again? We're not able to hear you.
Okay. Yeah, I have a bit of experience in share in all the situation I have in, because I'm from Botch State, and actually we're having so much commitment with Lassa fever issues, of which I'm always on field, and sometimes I find it difficult to, I attend the class, but my mind was somewhere, definitely. So I made to have a kind of mix of both the IM and the immunization. So later on, the day we have did the briefing with you, and you've given me all these resources, and I've taken my time to go through. After going through, I made to understand saw it, and I amended it. I have made all my review on other side, and even the situation analysis. Now I'm on it. Even today, since morning, I was on my computer trying to, put up and catch up everything. So I want to say thank you and thanks all colleagues that that I am, hearing they're taking some ideas from them and other things. So I want to say thank you. This is just the experience I can share with you now. Thank you. And over.
Okay. Thank you very much, Ibrahim, for sharing that experience. Hello. And congratulations to you for being able to catch up and for
thank you.
using the resources to catch up.
Yes, I appreciate it.
All right, so thank you very much. So I think that is it. I hope, Joy, that you have been able to hear all the feedback that has been given, and that is feedback you can actually go back to Peergrade if you think that all the feedback that you have heard here can help you to enrich this review. You can actually go back to Peergrade and you can add more information into your review. Just like you see here, I click inside, you can type. I don't want to type in your page, but I'm just showing you that you can actually add more comments because to enrich, to help our colleague to improve upon this work. And once you do that, you scroll right down and click on save feedback. So once you add more comments to the review of our peers, you can actually click on save feedback. All right, so now to answer the question that was posed by Syed Miraban Shah earlier on, as to when he has already finished the 3 peer reviews, when is he going to see the comments? So Syed, peer review is still ongoing. Peer review is still ongoing. It is until after the deadline, that is after 11:59 p.m. Friday, April 8th. that you'll be able to see the comments that your peers have left for you. And it's as from weekend, that is as from Saturday, that you should be able to revise your situation analysis based on peer feedback, based on the peer comments. I hope that answers your question. Oh, and I am. Oh, it's unfortunate that Joy actually lost her connectivity and she's just trying to get back into the room. So Syed, I hope I've answered your question. So it's as from Saturday that you'll be able to get the feedback that scholars have left on your work. So for this week, they have up till Friday to complete the peer reviews. All right, so that said, if there are no further comments or questions or concerns in the chat, I think we can end it here for this technical support session. And I'm just putting for, if you are still having doubts as to how to complete peer review, you can go ahead and view the tutorial that I just shared in the chat. And if you actually enjoyed the experience sharing just now, I want to invite you tomorrow for our regular experience sharing sessions with Dr. Francois Gas and myself at 12 p.m. Geneva time. So please, if you have already completed peer reviews, I'm inviting you to join us tomorrow for the experience sharing session. This is the link to register. I'm sharing the link, the registration link with you right here in the chat. Click on that link, register, and join us tomorrow at 12 at noon Geneva time for the experience sharing session. Come and share your experience with us. And I want to thank Joy for volunteering today to share her experience on peer review of the situation analysis. I want to thank Fam Daniel for the comments. I want to thank Syed, Miraban Shah, and everyone for their comments. Now I see Jackson Naima, whose hand is raised. Jackson, over to you.
Okay. Hello, can you hear me?
Yes,
hello?
Loud and clear.
Okay.
Yes.
Thank you very much. Thank you very much for this educative forum, for us to be part of it. For me, it's a pleasure. But as I speak to you, I've been finding it very difficult because of poor connectivity. It is true that I did I submitted the draft of my situation analysis, but I'm still finding it difficult due to time difference and connectivity. But I'm very, very, very interested at this activity. Even right now, you notice that I joined you late. But my main question is, where will I go to see my colleagues' situation analysis for me to make a comment or for them to do a comment in mine? And if that is done, how will I have access to mine to know whether I have something more to add or to improve on?
Okay, thank you very much, Jackson, for asking that question. That's exactly why we organize the situation analysis. If you're having connectivity issues, I just shared the link to our podcast in the chat. That way you can usually listen to our previous sessions, even using your phone, and this option does not consume much bandwidth. So Jackson, for you to do peer review, you need to go to Peergrade. You need to log into Peergrade. It's on Peergrade that you submitted your situation analysis. So you need to go back to Peergrade to complete the peer reviews. And I'm sharing the link with you in the chat. So the first thing you need to do is to log into Peergrade. Once you log into Peergrade, you're going to see this page that appears, asking you to give feedback for situation analysis. I hope you can see my screen clearly. To give feedback, once you click on give feedback, and I'm sharing these very quickly screenshots with you so that you're able to see because of the connectivity issues that you're having, and if you have been able to join today, it's important that we really get to help you well. So you click on give feedback. Once you click on give feedback, this page is going to appear, and this page you're going to see the first work that is assigned to you for review. What I'm advising you to do, because of the issues of connectivity that you have, is to click on download, to download the work. What I can actually do, let me see if that works well. I can actually look for you on Peergrade. I can actually look for you on Peergrade and show you
exactly what I'm talking about. So let me look for Jackson. Okay. So let me actually share what your page share grade. So Jackson, if you click on the link that I shared with you and you log into Peergrade, this is what your page, I'm sure you have seen your name here. So your name is there. So this is what your page looks like on Peergrade. And you have to click here, give feedback. So if you click on it, you click on give feedback, you see that you have received, you see a 0/3. It means that you have not yet completed any peer review. So you have received 3, and if you see 3, it means that you have actually received 3 works to review. So, and the first work that is showing on the screen that you can see here is submission 1. This is the first work that you need to review, and it comes from it comes from a colleague in Nigeria, thinking outside the box, immunization breakthrough in HGR and security compromised. That is areas. So as I was saying, if you are having connectivity issues, you can actually click on this download button to download this work and review it offline. You can, what I used to do is I used to download the work, I will print it out on my computer and take my time to read through it, writing down my comments, my feedback on the margins. Once I finish writing down those comments on the margins, I will log back into Peergrade when I have good connectivity, and then I will leave you. When you scroll down on the right-hand side, you see that here is the rubric, the guidance, the criteria of the rubric is actually here. So you scroll down, you see the comments. At the end, you are going to give a notation. You're going to an annotation for the peer's work. If there is an excellent, if there is a summary, if the person gave a cover note that is well summarized, you can say good summary requires minor improvement. And once you click on this, you need to add comments, explain why you gave him a good, why you think the summary is good and require minor improvement. What does he need to do in order to improve upon that? You do the same thing for all the different parts of the work. You do everything. I don't want to do anything on your page because it's your page, it's not my page. So you leave, you do it and you add the comments. When you move till the end, you'll be asked to submit feedback. So right now, if you click on submit feedback, you're not going to be able to submit because you have not written any comment. You have to write the comments. Once you do so, you click on submit feedback. And once you click on submit feedback, the second submission, this one is going to be unlocked. So as you can see here now, it is currently locked. You cannot see it because you need to complete the feedback for submission 1 before submission 2 is unlocked for you. And I'm happy to see that there's Sylvester Way that says, hello, Jackson, please contact me and I will take you through the Peergrade. So Sylvester, can you share your contact details with Jackson, or does Jackson know you personally? That would be great. Thank you for volunteering. Sylvester, that is the spirit of solidarity in the Scholar Network. So Jackson, I don't know if with this guidance, you are able to, you should be able to do
yes, I know
now. Yes, Jackson.
Sylvester,
yes.
I know bien vous Peter.
Hello, Jackson. Have you been able
Hello?
to?
Can you hear me?
Yes, we can hear you.
Okay, I'm telling you that I know my colleagues and we know one another, except that we are at various distances. And as soon as you have put me in touch with them, we will most of the time consult them.
Okay, so that is great. You don't need to be face to face, but I was asking you that, showing the different steps that I show you. Do you now understand how you are supposed to do the peer review?
Yeah. I've been listening to you. I want to learn. Even when you are talking about downloading, I download my situation analysis and fill it in before I could submit it. So I know about the downloading method.
Okay, so just follow the 3 steps that I've just shown you right now on your page on Peergrade, and you should be able to complete the peer reviews without any problem. And if you face any challenges, you can contact your colleague Sylvester. Is that okay?
Great for me. It is great.
All right. Thank you very much, Jackson, and I wish you all the best.
Thank you too for your excessive explanation.
Okay.
Yeah.
You're welcome. All right. So as I was saying earlier, if you are having any other challenge, we will meet tomorrow during the experience sharing session. And I'm just sharing the registration link with you again, right here in the chat. If you have not yet registered, you can register and come to share your experience with us tomorrow. Okay, so thank you very much and wish you, I don't know, Syed, is this the old hand or is a new hand?
It is a new hand. Sorry to disturb you once again.
No,
Just
you're
have
not
a question.
disturbing.
Just the last question that how many scholars will give feedback on the situation analysis? The situation
3
analysis
scholars.
here, 3% will provide feedback.
Yes, 3 persons will provide feedback to your situation analysis.
Okay. Okay. Thank you. Thank you so much. Thank you.
Yes, but there is a caveat there because, you know, there are many people. That is why we say your peers depend on you as you depend on them. So please, if you have not yet started peer review, it means you're going to penalize someone who needs your feedback to improve upon their work. Because at the end of the day, there are some people that are going to have only 2 peer reviews because there will be some peers that have not completed the feedback. So that is why I'm encouraging you. If you have any challenge, reach out to us. But just know that 3 people have received your situation analysis and they should be able to give you feedback by this Friday. Thank you very much, everyone. And looking forward to seeing you tomorrow for our experience sharing session. And I'll be inviting you to unmute yourself and put your hands together for you, for being here, for sharing, for learning together.
Thank you.
Thank you.
Hello, sir.
Thank you.
Thank you very much.
Bye-bye.
Just really,
Bye.
it's a great time.
Bye.